Colon cancer is considered to be a multifactorial cancer, and there are very specific risk factors that contribute to it. By far and large, the majority, the most common risk factor that we get asked about is family history. The other very strong risk factor for colon cancer is inflammatory bowel disease. We advise the patients that you do not wait till you have signs that are concerning for colon rectal cancer. And these signs, the common ones, are bleeding with the bowel movements, change in bowel habits, whatever the patient's baseline routine is, a change from that, and also persistent abdominal cramps that are inexplicable otherwise. Colon cancer is preventable, and the prevention is done using what many of us fear, which is called the screening colonoscopy. It's actually not something that we should fear. During the process, we can see polyps, which the majority of which are precancerous, and we remove the polyps at that time, which is essentially preventing a colon cancer from occurring. We talk about screening criteria for two different groups. The one group is the general population, and we recommend the screening colonoscopy at the age of 50. And in contrast, the high-risk group, which are the strong family history group, we usually recommend the screening colonoscopy at the age of 40 or 10 years younger than the youngest relative who developed at the time of diagnosis of colon cancer. Once the diagnosis of colorectal cancer is made, the patient typically undergoes a battery of tests to try to locate the tumor and stage the tumor. Following a battery of tests, a clinical diagnosis is made as far as the stage, and typically the patient will proceed to surgery. The majority of patients with early stage colon cancer are treated surgically and go on to have a full productive life equivalent to the general population as far as quality of life as well as duration of